in the clinician's dimension. And today, I would like to invite Assistant Professor Dr. Manaporn Chatchumni. She is the Senior Lecturer and Head of Academic Service Unit, School of Nursing, Rangsit University. She graduated her PhD in Care Service from Denmark. And today, she will share her experience about the clinician ideas about the technology transformation. She is our good partner because the School of Biomedical
My name
Engineering,
is Manaporn.
we working together closely in many of the project of the technology transformation. So today, please welcome Assistant Professor Dr. Manaporn Chatchumni.
My name is Manaporn Chatchumni, a distinguished professional in the field of nursing. I hold a Master of Nursing Science in Adult Nursing and a PhD in Care Sciences. Currently, I serve as a Senior Lecturer and Head of the Academic Service Unit at the School of Nursing, Rangsit University. My extensive experience and leadership in academic service are invaluable to the nursing community. Today, I would like to share insights on the topic paradigm shifts in healthcare, the clinician's perspective. This topic aims to explain the concept of paradigm shifts in healthcare, how these shifts impact clinicians, and explore future trends comprehensively. Today, we will be discussing the concept of paradigm shifts in healthcare. Definition: a paradigm shift is a fundamental change or underlying assumptions of a particular field. In healthcare, it signifies a significant change in the way healthcare is delivered, managed, and perceived. Let's explore the current paradigm shifts in healthcare. Digital health transformation, transitioning from paper records to electronic health records, EHRs, and integrating telemedicine. Patient-centered care, shifting from a provider-centric model to one that prioritizes patient preferences, needs, and values. Interdisciplinary care, emphasizing collaborative approaches where healthcare professionals from various disciplines work together to provide comprehensive care. Let's look at the historical perspective on major past shifts and their impact on healthcare practice. 1. From ancient to modern medicine. The transition from traditional remedies to evidence-based medicine. 2. Introduction of germ theory, shifting from the miasma theory, which suggested that bad air causes disease, to understanding that microorganisms cause diseases. This led to improved sanitation and the development of antibiotics. 3. Development of medical technology. The invention of imaging technologies, such as X-rays and MRIs, revolutionized diagnostics. Let's identify how these shifts impact clinicians. 1. Changing roles. From sole decision-makers to team collaborators, clinicians now often work as part of multidisciplinary teams, requiring strong communication and collaboration skills. 2. Increased use of technology. Adapting to digital tools. Clinicians must learn to use EHRs, telemedicine platforms, and other digital tools, which can improve efficiency but also present learning challenges. 3. Challenges. Information overload. The abundance of available data can be overwhelming, necessitating new skills in data interpretation. Maintaining human touch. Despite technological advancements, it's crucial for clinicians to maintain empathy and human connection in patient interactions. 4. Opportunities. Enhanced patient engagement. Technology enables better patient education and engagement, making patients more informed and active in their care. Improved outcomes. Collaborative, patient-centered approaches can lead to better health outcomes and higher patient satisfaction. Current paradigm shifts. 1. Digital transformation. Integrating technology into healthcare, such as electronic health records, EHRs, and telemedicine. 2. Patient-centered preferences, needs, and values in healthcare delivery. 3. Interdisciplinary teamwork. Emphasizing collaboration among healthcare professionals from various disciplines to provide comprehensive care. Form figure shown depicts health technology tools that enhance patient-centered care. Conclusion. This narrative review highlights the significant opportunities presented by patient-centered care and technology integration in addressing healthcare challenges like rising costs, chronic diseases, and patient safety. The shift from telemedicine to connected health showcases technology's transformative potential in enhancing patient-centered care and unifying the healthcare system. Trends like telehealth, wearable devices, and EHRs improve access, communication, and personalized treatment. However, critical issues such as data privacy, the digital divide, and the need for regulatory frameworks impede the widespread adoption of digital health solutions. Exploring future trends. 1. Predictive analytics and AI. Predictive analytics. Utilizing data to predict patient outcomes and optimize treatment plans. For example, algorithms can identify patients at high risk of readmission. Artificial intelligence, assisting in diagnostics, personalized treatment plans, and robotic surgeries. AI-powered tools can analyze medical images faster and more accurately than humans. 2. Personalized medicine. Genomics, tailoring treatments based on individual genetic profiles. For instance, customizing cancer treatments according to the genetic mutations in a patient's tumor. Pharmacogenomics, adjusting medications based on genetic variations that affect drug metabolism, reducing adverse reactions and improving efficacy. 3. Telemedicine and remote monitoring. Telehealth services, providing care through video consultations, increasing access to care, especially in remote areas. Wearable technology, devices monitoring health metrics and providing real-time data to clinicians for proactive chronic condition management. Continuous learning and adaptation. 1. Ongoing education. Clinicians need to continually update their knowledge and skills to keep pace with rapidly evolving technologies and treatment modalities. 2. Adaptability. Embracing change and being flexible in adopting new practices and tools is crucial for future success in the healthcare field. Practical examples. 1. Case study, EHR implementation. Before, paper-based records were prone to errors and inefficiencies. After, EHRs provide a centralized, easily accessible patient history, improving care coordination and reducing errors. 2 example, telemedicine during COVID-19. Impact. Rapid adoption of telemedicine during the pandemic enabled continuous patient care while minimizing virus transmission risks. Clinicians quickly adapted to new platforms and methods of patient interaction. Impact on clinicians. 1. Role changes. Clinicians' roles are evolving from traditional practices to incorporating advanced technologies and interdisciplinary teamwork. 2 challenges. Adapting to new technologies, managing information overload, and maintaining the human touch in patient interactions. 3 opportunities. Enhanced patient engagement, improved health outcomes, and the ability to leverage data for predictive analytics and personalized treatment. As shown in the figure, the concept of Healthcare 4.0 illustrates these changes and impacts on clinicians, highlighting the integration of digital transformation and patient-centered care. Future trends. 1. Predictive analytics and AI. Utilizing data to predict patient outcomes and optimize treatment plans. AI assists in diagnostics, personalized treatment, and robotic surgeries. 2. Personalized medicine. Tailoring treatments based on genetic profiles. Pharmacogenomics adjusts medications to reduce adverse reactions and improve efficacy. 3. Continuous learning. Clinicians must continually update their knowledge and skills to keep up with evolving technologies. Future suggestions. 1. Develop ethical guidelines. Engage stakeholders to create a code of ethics for the responsible use of ChatGPT, other large language models in healthcare and academia. 2. Address accuracy and bias. Implement strategies to minimize bias, ensure content accuracy, and enhance transparency. 3. Enhance cybersecurity. Strengthen measures to protect sensitive health data. 4. Improve training and education. Provide training for healthcare professionals on the effective and ethical use of AI tools. 5. Monitor and evaluate. Conduct ongoing assessments of the impact of ChatGPT on healthcare outcomes and educational processes. 6. Revise authorship guidelines. Consider revising ICMJE COPE guidelines to address the role of AI in scientific authorship. Conclusion. This systematic review highlights the promising applications of ChatGPT in healthcare education, research, and practice. Benefits include enhanced scientific writing, improved research efficiency, streamlined healthcare workflows, and personalized learning. However, significant concerns exist, such as ethical issues, risks of bias, plagiarism, inaccurate content, and cybersecurity threats. While ChatGPT has the potential to induce paradigm shifts in the healthcare sector, its use must be approached with caution, and it currently does not meet the criteria to be listed as an author in scientific articles. School of Nursing, College of Biomedical Engineering, College of Digital Innovation Technology. This collaboration involves 3 colleges, NMBRSU Innotech and Wellness Center, working together to drive innovation and advancements in technology and wellness. The College of Biomedical Engineering, Faculty of Nursing, and College of Digital Innovation Technology have come together to innovate and provide advanced healthcare technology. Our aim is to meet public needs in health promotion, prevention, and rehabilitation through academic research and innovation. We integrate nursing expertise with modern healthcare tools to enhance self-care. Our services include guidance on using advanced healthcare equipment, procurement and rental services for medical devices such as home-use oxygen concentrators, air mattresses, and blood pressure monitors. These model on figure shown, our services are offered as both revenue-generating and academic initiatives, providing practical training opportunities for health-related students from both domestic and international backgrounds. Nurses approach customers using a case management model, which involves a comprehensive, coordinated approach to patient care. This model includes several key components. 1. Assessment. Nurses conduct thorough assessments of patients' health needs, considering medical history, current conditions, and individual preferences. 2. Care planning. Based on the assessment, nurses develop personalized care plans that outline specific health goals and the steps needed to achieve them. 3. Coordination. Nurses coordinate with other healthcare professionals, such as doctors, specialists, and social workers, to ensure that all aspects of the patient's care are addressed. 4. Implementation. Nurses implement the care plan by providing direct care, administering treatments, and educating patients on managing their conditions. 5. Monitoring. Continuous monitoring of the patient's progress is conducted to adjust the care plan as needed, ensuring optimal outcomes. 6. Evaluation. Nurses evaluate the effectiveness of the care plan, making necessary changes based on patient feedback and health outcomes. 7. Advocacy. Nurses advocate for their patients, ensuring they receive the necessary resources and support to achieve their health goals. This holistic approach ensures that patients receive comprehensive, personalized care, improving overall health outcomes and patient satisfaction. Our offices are located in Building 4, Science Building, at Ranksit University. For example, our team provides care for post-stroke patients at home and also teaches our students in the clinical practice course. We have organized a wound clinic that provides innovative wound care solutions tailored to patient needs. As shown in the figure, we care for patients with diabetic foot ulcers to prevent the need for amputation. This case, palliative care and end of life. We helped organize care with the patient's wife to fulfill his wish to die at home instead of in the hospital. We supported them with necessary equipment and continuous monitoring at home until he passed away peacefully. Innovation and research. Our team developed and evaluated an innovative system for recording and monitoring antigen test kit, ATK, results among 203 company employees. Designed based on evidence-based principles, the system encompasses 6 components: user access rights and basic data, preliminary risk factors and questionnaires, personal ATK result recording, expert review of ATK results, data view and reporting, and system architecture and process. The analysis revealed that the system effectively recorded ATK results with a user base of 59.11% males and 40.89% females. Vaccination coverage among users was relatively low, with only 49.26% receiving the first and second doses, and the same percentage receiving the third dose. All ATK tests conducted were negative. Key points. 1. System components. The system includes user access, risk factors, result recording, expert review, data reporting, and system architecture. 2. Effective recording. Successfully recorded and monitored ATK results for 203 users. 3. User demographics. The majority of users were male, with 49.26% vaccinated with at least 1 dose. 4. Negative results. All ATK tests reported by the system were negative. 5. Practical use. The system is practical and convenient, supporting various devices over the internet. By addressing these key points, the study demonstrates the practicality and effectiveness of the developed ATK recording and monitoring system, highlighting its potential for broad application in similar contexts. If you have any questions, you can contact me via my email shown on this slide.
Okay, this is the short lecture from Dr. Manaporn. So the next session, it will be the questions and answer. In the case if you're not clear, we will explain more about the model of the collaboration between the School of Nursing and together with the BME from Biomedical Engineering. So from the lecture, you can see that the role of the biomedical engineering is not only taking care of the medical device anymore, but we expand our duty to like the collaboration and do the solution together with the clinicians to provide the effective healthcare. In Thailand right now, we facing with the elderly care and home care. From the case study, you saw that we have like the patient who getting sick at the house, and sometimes it was like that the last period of their life, so they return home instead of staying in the hospital. However, the quality of life still there. So sometimes we got the request from the patients at the house, and then we just like provide the palliative care. However, to taking care of the patients at home is not only the hands-on work or the taking care by the nurse or the clinicians. However, they require some of the medical devices. So biomedical engineering, Rangsit University, we have the center that we call Innovation Center. So we also service some of the medical devices to the home care neighborhood around the university. So in that case, if we got the request from the patients who are at the home care, so we go out together with the clinicians or the nurse, and then we go together with the basic medical devices. So this is the way that we are working right now to improve our quality, our neighbors' quality of life when they have the condition that not going to the hospital. This is the case study that we are sharing. So, Ajahn Anuchit, do you want to share something more?
Okay, if you see in this lecture, already you can see about how to take care your patients. Okay, and in this slide it show you for the traditional of the service in the hospital is the only service in the hospital only for the patients. But now in the trend in the futures, you're not be the patients can service with the hospitals. That means the healthcare is come to change and develop of the technologies. That means by medical device may be change with the concept because if you see in the world now they have the many of the smartwatch. The smartwatch it can measure the blood pressure, pulse oximeters, and many of the health data. That means this is the data is have importance when you go to the hospitals. Okay, and Ajahn Sani talked to you already. If your patients go to live at homes, what the medical device they use and how to manage many of the these medical device in the concept of the patient centered care.
However, in the home care, the basic medical device always be request from us. For example, like the the digital pressure, blood pressure meter, and also some of the patient request for the oxygenator because they have some problem with the breathing. So that's why this is a basic device. However, some of the device can operated by the people who taking care of the patients at home, not request for like the professional to operate it. However, the medical device always be taking care because once you rent the medical device from the faculty or from the community hospital, of course, you are not engineer and the device is there. However, you can be sure that medical devices still working well. That's the questions. So that's why BME, biomedical engineer from Rangsit University, we provide the service, not only the medical device in hospital, what we provide the service on the home care use. That is the duties that we are working. However, because of the limitations of the staff, so we only develop and implement this thing only the neighborhoods around, not that far. But in the future, we're going to expand the connection and we can provide their service more in this case.
Okay, that's now is lecturers.
Yeah,
Is come.
welcome Dr. Manaporn because she was on the duty. You know, this period we have the two granted from the TICA. So that's why the School of Nursing, they receive the grant from the TICA and they provide the training also. So that's why we just like that. Okay, we run up and down for the training. So thank you very much, Dr. Manaporn, to sharing us today. So in the case if you have some questions, please feel free to ask. Yes.
After you listen my lecture.
Do you have any questions? Maybe you can share the condition of your home country. Because right now, as I told you that the limitation of the patients in the hospital in Thailand sometimes is limited.
Yep.
So we are going to the elder society This is the thing that our government concern a lot. So that's why we improve for the service, not only limited in the hospital, but we focus more for the home care service. Yes. So this is a way that we try to implement and synchronize the technology together with the patient's care by the clinicians.
First thing, I want to know, how do you do in your country with innovation or digital health?
How
Please.
about the digital health in your home country and how you work together between the biomedical engineer and the clinicians? That's what we want to hear from you. Can anyone share together with us? Because it is very early in the morning, I guess, but it will be more active in the afternoon. But in the case if you still have no question now, okay, you can keep your questions and then you can discuss with us in the afternoon also. Okay, one hands up from Mr. Afudi. Okay,
Yes.
please ask.
Yes,
Hi.
Ibrahim Awal from Ghana.
Uh-huh.
Thank you so much for insightful lecture. It's good to know you are doing a lot in this dimension.
Mm-hmm.
In Ghana, we are not so much inclined to this level when it comes to home care.
Mm-hmm.
We don't have a lot of support for elderly people where we even go to homes. That's the first part. Yes, the second part is although we collaborate on equipment, we don't go this extent because we don't have the technology as you people do. Usually the collaboration is before a new device is introduced, where you go to the nurses station or you organize a training on a device you're about to introduce into a particular facility. That is where we train them. We train the clinicians on how to use, and that is where we meet. Or when they have problems, they call you to come and solve the problems. That is basically what it is. Apart from that, it is a doctor or a clinician that calls you, oh, I'm having this problem or I'm having this challenge using this device. Or this is the way a particular patient is responding to the treatment we are giving with regards to a particular equipment or a particular technology. So that is as far as it goes for where I am in the central capital city of Ghana, Accra. So that is what it is. Now, we have teaching hospitals, which have different level of interaction with the biomedical engineers, the lecturers, and our patients. Because it's a teaching hospital, they have a more collaborative way of handling issues. Because a lot of research goes into it. So places where there are biomedical engineering departments, like University of Ghana, they bring students into the University of Ghana Medical Center to do hands-on to see how devices are used and all that. So that is happening. That is another thing that is also happening in Ghana. Thank you so much.
Thank you very much for your sharing. It's very impressed and valuable information to us because we are in the different, area in the world. So we have no idea about another country. Okay, we can have the idea about, the healthcare system in Asia and sometimes in European countries because Dr. Manaporn graduated from Denmark. So another area, it will be like, okay, we want to know more and we looking forward to collaborate to all of you guys in the future because our dream is just like, okay, how to give the patient safety by the technology because the technology nowadays is just like, increasing very fast. So the question is how to use the technology effective and performance for our healthcare system. That is, we looking forward for that.
Okay, from your question, how do you get clinical data from? Okay, we get the clinical data from our connection with hospital and primary healthcare in near our university. They keep our contact with personal contact and send the data how to need to get about the innovation for resolve the problem for clinical. Right now we get the data from some hospital have the patient with diabetes mellitus type 2 and they suffer when they check diagnostic the blood sugar by cell and like a pin and every day is hurt something.
Right.
And
it's an invasive. So in biomedical engineering college, helping that. So we develop like the non-invasive blood sugar level. So you can just touching your finger into the machine that we developed, and then the data will send in via the data logger. In the future, we develop the system that the doctor or the nurse who taking care of that patient can access to the blood sugar level of each patient's monitoring, like monitoring, something like that we are developing. But it's kind of difficult in Thailand. The limitation is not only for the ethical issues. However, it's about the standards. When you invent the new medical devices, it is like, the dead valley that we call, because we stop. We can develop the technology by ourselves, but okay, when you're gonna use it for like the population of the patients, one thing that they ask, okay, how about the ethics issue and how about the standards? So that's why we are sometimes like only the research level, not the commercialized level yet. And then I would like to answer Mr. Avudi the questions because of the limited of the medical devices. We faced that problem before, but we try to solve the problem by we set up the center of the medical device and we use the pool system. It was like example that, okay, you have the library, central library. So if you want to borrow, okay, just go into the center and then taking care of the medical device, like you borrow the books and then when it's already finished, so you return back. And then the people at the central office, they taking care of the medical device and ready to use for the next case. That's what we are doing. And of course, by that system, the CMMS, computerized medical device managed system, is very important So that's why on the next lecture, we're gonna give you an idea how to use the computerized medical device management and how to implement it for more effective on that way. Did my answer miss your questions?
Please. It has. Please, I also want to know how many biomedical engineering universities do you have in Thailand? Any idea?
It's the very big numbers because of
Okay.
from the first lecture from my dean of school of biomedical engineering, you can see that in each year, each university, we can produce the many of the biomedical engineers into the career. However, most of them always go to the private company. For example, like the service engineer, the sales specialist, or the medical device specialist, because of their, more income. However, some of them work into the hospital, but right now the number is a little bit increasing because the scheme of the healthcare system in Thailand, previously, we never had the biomedical engineer position in the hospital. So that's why we are transforming because previously, the one who taking care of the medical devices in the hospital, for example, like in the public hospital, mostly are the nurse. And you saw that the nurse full of the duties by themselves because they have to do the patient cares, blah, blah, blah. So that's the gap and the limitation. So that's why we try to start the engineering career in the hospital right now. So we are going for that. And in the system that I mentioned about the pool service, not all of the medical device can be pooled because it's due to the number and due to the service that you provide. Mostly, they are just like the common medical devices. For example, like the infusion pumps that we are pooling system. In the hospital, maybe we use like the ventilator can be pooled. However, for like, of course, the X-ray, okay, is stand there, so we cannot pull. It depends on the medical devices. And sometimes the medical device that can be mobile, maybe it's easier to go into the pooling systems. And for the questions about the biomedical engineers, right now, we have limited of the position career in the hospital. So that's why we have like the outsourced service to solve this problem. The outsourced service, just like that, okay, they have the company and they provide the service by the contract, maybe annually contracts to the hospital, and they send the biomedical engineer to stay at the hospital and work together with the personal staff in the hospital. That the way it be in Thailand. So on the next lecture, we're gonna give you more the perspective of this the scheme. Okay.
Any question or any sharing?
How do you get clinical data from? Okay, Dr. Manaporn already answered it. Yeah. Any more questions?
Yes.
Please feel free to ask.
Hello?
Hello. Yes, we can hear you.
Yes. So I think Ghana and Thailand have a lot of things in common when it comes to the biomedical engineering industry. Just that you are moving very fast, trying to solve your problems. In Ghana, we have less than 10 biomedical engineering colleges or universities. And as at last 5 years, most of them were not around. We had less than 3 of them as at last 5 years offering this course. So it's a bit challenging. So I think along the line, you would have to give me more details into how you are constantly improving and attacking all the problems one by one for Ghana. Thank you so much.
Yeah. Okay. We are happy to just sharing together with you because, as I mentioned that we are far from the other side of the world. So we don't know your background. That after we getting to know each others, I think that we can share many things together. And of course, in the case, if you interested for more idea, not only in this training, you can always contact us and we can discuss and collaborate in the future. I think that right now in the world, we have no boundary. So that's why please feel free to contact us and we can, if we can help, we can do the work and we can join together in many dimensions.
I think we can learn together.
Yeah, we can learn from you too. Maybe you have your strength and we have your weakness. That's why yesterday we assigned you to do the SWOT analysis because we want to see how's your strength, how your weakness, and how to help and how to learn from you. So that's why this is the main objective that we did for the SWOT analysis that we assigned you yesterday. However, we welcome all of the students all over the world to study in Rangsit University at the biomedical engineering, because right now we have the international program, and also we receive some of the students from Bhutan. They graduated from us.
Russia.
Yeah, from Russia. Right now we have the students from Nepal, from China, from Myanmar. So that's why we are like the international environments here, but we haven't had the students from South Africa yet. So we looking from Africa. So we looking forward if you can join us.
Yes, very soon we are going to join.
Hi.
Hello.
Hello.
Good morning. Yeah, good morning, Professor.
Makonjo, right? I pronounce your
Yes,
name
Professor.
right? Uh-huh.
Yeah, that's correct. No, I just wanted to ask, how
Yes.
long is your degree program of biomedical engineering?
Oh.
International.
4 years. 4 years.
For bachelor.
Okay,
For
no.
bachelor degree, we have 4 years. But in the case, if you continue the studying from bachelor to master, we have the intensive program. You study for 5 years and you get both of bachelor and master degree. And we also have the program of PhD, but it's more like, going to the research. So we have full of the program.
The master degree online.
The master degree online, it can be, but okay, maybe better if you come to here and do the research. And of course, you can just like put your case study from your country and we just like make like the topic of the thesis.
Opportunity
This
for learn
yes.
the online.
Yes, maybe just like that you want to develop your smart system by technology, biomedical technology in your home country, so you can use that topic into your thesis also.
All right. No, my last question is when we are here, we are also representing our people in Namibia here. So I just wanted to know now, what about if someone is having a diploma in biomedical engineering and you want to apply for a degree program? Is he still going for 4 years? Or you will
for the
look at
diploma, you already received the diploma, right? For the diploma, we can talk, maybe you can have less of the 4 years, because previously we set up the program from the Lao PDR. Some of them graduated diploma, so we can manage the cost and make their schedule for them so they can graduate within 2.5 years and get the bachelor from us. Yes.
Okay. No,
It's
thank
like
you.
the special case, we can just like discuss on that.
Thank you very much.
Master degree.
Do you have master degree scholarships for international students? Oh, it's kind of very difficult to get the grant. Maybe you can ask the grant from your home country and then you come to us because for the scholarship here, we are the private university, so it's kind of difficult. Yes.
Our university not yet right now.
Yeah,
But-
okay, for an example, some student from Bhutan, they got the grant from their home country and come to us because they have some of the collaboration. Yes. Mm-hmm.
Morning, Professor.
Morning.
Yes, I would like to end to the point of Master Mekonjo. I'm also from Namibia. So, how is your entry program like? Is there a way of like maybe you have forms or you just apply? How is the application? I just want to know how you can apply to enter your universities.
Program.
Is there forms that maybe you go online?
Yeah,
or...
online, of course, online. We can provide you if you're interested. You can do the applications online for the master degree program, no problem. Yes.
We will send the information more
Later,
more
yes.
via your email if
Mhm.
you're interested.
Yeah,
That
just
you,
request. Yeah.
you can
Make the request and
contact,
then we can provide the link of the application and more information. We're gonna give you the section of like the faculty touring, just like, okay, you can see how the facilities, and luckily that you cannot come on site. So we try our best to make like the virtual tour. Yeah, later, but we are, they need the camera and things so the videotape. So that's why we are working on it. And when you ask about the clip video of the lecture, we are managing and we are uploading and we gonna set up the YouTube channel, right? So we're gonna provide the link of the YouTube channel, then you can just access and you can see the previous lecture that we gave to you. However, for tomorrow lecture, it will be the very special lecture that I would like to encourage all of you guys because it will be the live lecture from one of the famous professional. He is a doctor in in the biggest hospital in Thailand that they implemented the smart hospital. So that's why tomorrow it will be the special lecture. It will be on the Thursday, Friday, and Tuesday. They are the magnet of the speakers that we want you to join us. And maybe you can share more your idea about the healthcare system with them.
Okay, and I'm not yet clear with them because okay, for the diploma holder, so yeah, can I able like to upgrade to bachelor online or is only
The
you can
bachelor
only
is on
offer when
site.
somebody
And luckily, it cannot be online because, for the bachelor, we not only give you the idea, but you need to hands-on on the medical devices. You need to practice how to maintenance, how to do the corrective maintenance, and it cannot be online for the bachelor and for the master also. But sometimes the master can be adjustment because if your topic is related for the IT and programming, I think that it has no problem that you do the online. However, for the bachelor, cannot be online. I'm sorry.
Okay, thank you.
So more questions?
question for our service with collaborative. We can continue with explain about the collaborative 3 college by nurse, BME, and IT college. After
you
can see
the simple
my
of this.
video and how your question. How do
So
you
right now, she introduced that already that we have the N and B RSU Innotech and Wellness Center. So this is the collaboration between the three faculties of Rangsit University from the School of Nursing, College of Biomedical Engineer, and also the IT College. So that's why we hands on together to work to the development of the new technology. But basically, it's just like we develop the healthcare system for service.
we try to like study with the new model about with like for example with our student for learn collaborate with the real practical at home at hospital.
Yes.
We can continue to study.
Okay, we have the question from Deepika. Okay, from the question, you asked that have the hospital shift fully from paper-based to electronic in Thailand? Yes, we have. For example, like Bamburat Hospital, Payathai Hospital, right now they are paperless of the hospital. And I think that tomorrow our guest speaker will give you more example about that. However, some of the biggest hospital in Thailand, for example, they are from the public hospital like Sirirat Hospital, Ramathipadi Hospital. They are very, very big. And it was like that they established for 100 years already. So it takes time to change. But right now, in every hospital in Thailand, we tend to do the electronic and we tend to have the paperless hospital. Yes. But some of them still in the middle trying to adjust. But the strategy of the Ministry of Health, they want all of the hospital to be in the electronic and paperless hospital.
We try to transform to smart hospital.
Yes.
In the idea.
Yes.
Further.
Yeah. In the future, we dream that we're gonna transform all of the hospital and healthcare sectors in Thailand to be the smart hospital. That's why the electronics and paperless is the first step to become the smart hospital. Yes.
So, any question?
Any more questions? If you still have no question, maybe you're just thinking, or some of you still working or still on the bed. So you can just like,
your country.
Later, because I think that this is a different of the time zone. Okay, another question. Where? Oh, we already answered that. So you always communicated with us via the WhatsApp. Okay, raise your hand. Okay, Mr. Nabola. Okay, please.
Hello, Bula Vinaka. This is Willie from Fiji.
Fiji, hi, Fiji.
Is this smart medical is the same as e-medical?
Yeah, e-medical almost the same. Yes, because everything is based on the digital
start
base.
to move on to digital format, I think it will be easy in making a spare part request in all these things rather than using the paper. We just have to use our electronic mails of how to communicate and how to order parts. And I think we'll be learning a lot from the training tomorrow. Thank you.
Yeah, okay. For more information, in our opinion, I think that the e-medical is a subset of the smart hospital, because not only the electronic things, but nowadays everything transformed from electronic IT to digital. So it gonna be coordinate and composed with not only the system, but however the infrastructure, the IT, medical devices. That is the way of the smart hospital. So the e-medical is just like the one of the part of it. Yes.
Thank you.
Yes. Okay, more questions? Okay, if you still have no more questions, I think that today it will be the short lecture and you can prepare your assignment and come back to us in the afternoon. Also, if you don't have the question now, but maybe the questions pop up later, you can think about that and then type on the WhatsApp or keep your question, and then you can ask us again in the afternoon session. It's always be like, open class discussion always, so no problem. Okay.
Okay.
Okay, I think that if you have no more question, today it will be a little bit early of our lecture class. So see you again in the afternoon session. And I think that, okay, you will be the increased number because the people always, active in the afternoon. Oh,
Thank you.
okay, thank you. So you can return back to bed in some time zone and you can return back to your duty at the office. And I think that from Fiji, you are in the afternoon already and you get ready to go back home later on. Okay. See you again in the afternoon at 1 p.m. Thai time. And right now the timing is, okay, we show you at the 10. So you have some of hours for taking a rest before return back to us at 1 p.m. Thank you very much.
Thank
Thank
you
you.
very much for
Thank
lecture.
you.
Thank you.
Thank
You're
you.
welcome.
Bye.
Thank you. See you later.
Bye. Okay, I saw that Mr. Franklin, you just raised up your hand. Okay, you want to ask something? Mhm.
Hi
Okay.
everyone. Yeah,
Hi.
there is a trouble on my computer.
Okay. So see you in the afternoon then.
I'm from Ecuador. Our, the time right now here is 10
time?
p.m.
10 p.m. Wait, 10 p.m. Where
I'm
are
from
you
Ecuador,
from?
South America.
Oh, South America. So that's why. Okay, we are okay, totally different. We are 10 a.m. now and you are 10 p.m. Oh my God.
Yeah. I'm trying to learn with
Yeah.
with
Oh, it will be
you,
kind of
but
difficult for you
I'm
in the
trying.
afternoon session, right? Because it will be 1 a.m. on your side.
Yeah.
Okay. So we're gonna try to record the video and we are managing it because the clip video need to be, a little bit managed before we upload it on our system. And we're gonna provide you the link so you can get in on the lecture. However, the practice, maybe you having the problem, so you can discuss together with your friend when you're free and just like give the presentator, representative to us. No problem. In the case of the limited time zone, we are fully understand that.
Thanks. Lots of thanks.
Thanks too. Okay, if you have no more questions, okay, see you again at 1 p.m. Thai time then. Okay, bye-bye for now.
Bye.